Americans spend $2.25 trillion a year on health care, a huge sum that experts say will double in the next 10 years, even if nothing is done to rein in costs. Norman Ornstein at the American Enterprise Institute says the problem will only get worse.
The uncertainty, the higher costs every year, the changes in behavior every year, the reduced options, all come with no change in the system.
That's because health spending has been rising faster than American paychecks. According to the Health and Human Services Department, total health costs have risen from nearly 6% of the nation's GDP in 1965 to 17% in 2008. At the current pace, some warn health care could eat up as much as 41% of income by the year 2036, driving more Americans to drop their coverage.
Thank you so much.
Addressing members of Congress on Wednesday, President Obama said maintaining the status quo is not an option.
Everyone in this room knows what will happen if we do nothing. Our deficit will grow, more families will go bankrupt, more businesses will close.
But some private insurers say the president's proposal amounts to a government takeover of health care. Karen Ignani heads a private coalition of health insurance companies.
We're creating a new government-run program that is going to swallow up everything else.
Some economists say that's not true. Research analyst Ann Mathias says that's like saying the U.S. Postal Service will drive Federal Express out of business.
Can you think of any government-run company that's been able to drive a big private sector company completely out of business?
But with a price tag of nearly $1 trillion over 10 years, critics argue health reforms could derail an already fragile economic recovery. Economist Mark Zandi admits it's a gamble, but one the president has to make.
Healthcare reform has to reduce the growth in healthcare costs in the long run. And when I mean the long run, I mean 10, 20, 30, 40, 50 years. If we don't do that, then our budget problems, our fiscal problems are going to be incredibly severe and significant.
Zandi says the nation's inability to address the challenges arising from higher health care costs could ultimately damage investor confidence, further weakening prospects for a full economic recovery. Arcega, VOA News.